Hi, I'm Dr. Natalie Chang, and today we'll be giving you a virtual tour of our Lorraine Brownrigg Intensive Care Unit. This is a really exciting day, and we're going to hopefully give you a brief snapshot of the great work that's been done. Would you like to introduce yourselves?
I'm Dr. Doran Linden-Smith. I'm the Physician Site Chief for Critical Care here at Dartmouth General.
And I'm Polly Henry. I'm the Health Services Manager for Intensive Care at Dartmouth.
And I'm Cynthia Eisner. I'm the Health Services Director for the Dartmouth General Hospital.
Cynthia, can you tell us a little bit about the new design of the ICU unit?
Absolutely. I think what's exciting for our team is that we've gone with what's called a horseshoe racetrack design. Essentially what this means is that we have improved efficiencies of workflow for our team, but also improved visualization across the entire unit for the ICU staff.
You can see that our team worked really hard around the colors and the textures in the department. We actually had Dr. Linden-Smith and one of our nurses work on the colors, and it's warm and inviting for staff, and families and patients, very clean. And the amount of natural light that is in this area is just amazing. It's so exciting for our staff from research that it's very important from your day-to-day work. So I know it's still a little bit under construction, but we're very excited.
So we're standing right now in one of the best new additions to this building, which is an isolation room in the Dartmouth General ICU. So this is capacity that we previously did not have on the site. We have very few places to isolate patients with specific infectious diseases. And this room is our largest, and it can serve to do multiple different procedures that we've been unable to do in the ICU before because of airflow. So things like bronchoscopy, or putting a camera down into the lungs of patients to collect samples, or to take biopsies, can now be done in the intensive care unit with very unstable patients in a safe way with excellent airflow and a lot of space and light, as you can see.
So this would count as a negative pressure room.
This is a negative
pressure room.
Yeah, exactly. And so maybe Heather can speak to the importance of the ante-room, which is a feature of a true negative pressure room.
So the ante-room, the staff enter from the main part of the ICU and into this room, and this is a place that allows the staff to apply and remove their personal protective equipment, which we've gotten very used to in the past 15 months from COVID, but we would need it for lots of other presentations. And it just helps ensure that we contain any infectious matter so that we don't contaminate ourselves, our patients, families.
So Lindsay Corkum has joined us. She's one of our educators, clinical nurse educators. But I just wanted to show the donors that the amount of space in the room, because that's one of the bigger things that we see here from a patient perspective, is that there's actually a footprint in the room for patients and their families, which there wasn't in our current ICU. Not to say that we didn't do our best in that space, but from the bed to the windowsill in the old space would have stopped midway to this boom. So basically, that's the amount of space that we had from the patient's bed to a wall or window. So often the patients would kind of crouch, leaned up against the windowsill, and sometimes I felt like they were invading the nurse's space and impeding what they were trying to do. So we actually have a footprint now for patients and their families to be part of the experience. It's difficult to be in ICU, and it's been a difficult year with the restrictions, so we're looking forward to having patients and families back in our areas. And this is just a warm and inviting place, as best it can be when you're critically ill.
Important for staff to work around the patient as well. Most of our ICU patients are on life support, and the ventilator takes a fair bit of space that we now have a dedicated area for. We have so much better access to the monitors. A lot of procedures need to happen on patients in the intensive care unit, and so having access to the back of the bed and the floors clear of tubes and wires is going to make it infinitely easier for the physicians and the staff to work on the patients here. The booms are a big part of it, and perhaps
the booms are a big part of that. They create a lot of space, so they can easily be moved. It's very, very light. I'm putting no effort into this. And we can move it based on what we need to do for the patient. If we're intubating, putting in lines, etc., we can move it so that you can go 360 degrees around the bed. We can also move it so that patients can look out the window. They can be face the window and enjoy, especially if they're palliative comfort. We can move it so that they're looking out the window and enjoying that, the view, rather than the wall. So it's wonderful. The windows are beautiful. We're very happy with the windows in the rooms and the natural light that they allow.
The other piece around the space is the geographical location of the space. We're nestled between the emerge department, the OR, and diagnostic imaging. And so from a patient commute perspective, with physicians and healthcare team members at the bedside, it's a much quicker commute. Currently, they would need to get into the elevator to come to the 4th floor, which has been cumbersome and difficult at times. As Dr. Lynn Smith said, they're critically ill, often on life support, and it's a big commute. And sometimes people are unstable, and it's difficult to move them generally, let alone between floors. So we're really excited about where we're nestled, because we'll be a quick hop over to CT, only about 40 paces down the hall to the OR, and literally right next door to the ED.
Yes, it'll definitely, I think, improve flow from the into admission to the ICU. For sure, we've been in contact with our ED colleagues on how we can improve flow and make admission an easier process for patients and their families and staff.
Primary care is so important.
Yes.
Can you also tell us a little bit about the impact of the privacy and infection control improvements that have been provided by the space?
Yeah, just the larger space alone is a big deal, but the improved airflow in this space compared to our old location in the old part of the building on the 4th floor makes a tremendous difference for infection control. Now we have sinks in every room, which I think previously we had one sink for the entire intensive care unit. So sinks in every room, hand washing stations. We have a clean utility room and a dirty utility room that are separate, which is a big bonus as well. So there's lots of features they'll make it a lot safer to care for patients with infectious diseases in this unit as compared to our previous space.
Yeah, and privacy is enhanced. We have all 8 single rooms now, where we had an open flow with 3 rooms with just curtains divided in our previous space. So to have all 8 private rooms is something we're really looking forward to as well.
And then we have the addition of the consult room here in the unit, which will help the physicians have private conversations. Often they were held in an ICU waiting room on the 4th floor, which we did make do, but we often had to ask other patients and family members to step out so those conversations could be had. So this will be a great addition.
One of the other amazing features that is in every single one of these new ICU rooms here at the Dartmouth General Hospital is these booms, and we've heard about those from the clinical team already, and how mobile they are and how integral they are in creating space within the critical care environment. The environment in the space is so essential in improving the mobility of every patient that comes into the ICU. We know from literature that the earlier we get people moving when they come into intensive care, the less amount of time they actually have to spend in intensive care, and therefore even in the hospital. So we've really started working at and looking at how do we integrate that philosophy into our environment. You can see here that every one of our rooms has what's called an integrated lift. And so this is something that is essential from care delivery. Heather Petal-Bolivar is one of our clinical nurse educators that works with our critical care team and the emergency department team. And she works with Lindsay and Holly, and they focus on how do we better move individuals, but also now use this new technology that we have to help improve mobility for our patients.
So as the team has mentioned, in our previous space, the patient had to be orientated in only one way. We couldn't turn them in any other way. Part of the other issue is access for staff. So everything was attached to the head wall with these booms. Now we can move them, as Lindsay said. We can get to the head of the bed to facilitate putting in lines and doing procedures. And it actually keeps our staff safer because we're not ducking under wires and tubes and such, which we certainly wouldn't want to disconnect from our patients.
We also have a procedure light at every bedside, so we can add light to different areas if we're doing wound care for the nurses, or we're doing placement of central lines or specialized things like that. We have a lot of natural light in the unit, but also a lot of other sources of light that will make it so much safer.
Our current space, the ICU on the 4th floor, we don't have a patient shower. We have a patient washroom, but not the ability to take a shower. So we do serve as a coronary care unit as well as an intensive care unit. And so we do have some patients that would be able to take advantage of the ability to shower. So we're excited to have that to offer to them.
So much space here for charting, for computers, there's space for everyone in the staff to be able to work independently and together as a team. So major improvement compared to what we've been living with for many years.
I think this new space is going to make such a huge impact on both the patient experience as well as the quality of care that we're able to provide. You know, the functionality of the space of the rooms, the improved safety aspects, it's going to make such a big difference, and we're so appreciative.
It really was a collective effort. You know, the design team, the redevelopment team, central zone leadership, the clinical staff, the Dartmouth General. It was a collective. It didn't just happen. PCL, it's been amazing to work with. So just really appreciative of the amount of effort that's gone into this project. It wasn't done alone.
On behalf of the Dartmouth General Hospital and the intensive care unit team, we thank you.